Hello and welcome to this series of videos about study and learning skills for undergraduate medical education. My name is Mohamed Hassan Taha and I am the director of the Medical Education Center at the University of Sharjah. And I will be presenting this series of videos to support you as undergraduate medical and dental students in the learning process. Today's video will start talking about professionalism for medical and dental students. Today's session we'll be discussing the professionalism in medical education, the principles, the core concepts, definitions, and elements of professionalism, why we should study professionalism as medical students or dental students, examples of professional and non-professional behavior, and finally, the take-home message. Why we start talking about professionalism, and it's important now. Professionalism is the core competence in medicine and in dentistry. So it's not, it's no longer an attitudinal arts or something that is a hidden curriculum only. So it is a core competence, and as far as it is a core competence, most of the competency framework now integrating professionalism as a core competence for healthcare professionals. Not only this, international regulatory bodies, accrediting agencies, or licensing require evidence that the graduates should demonstrate these professional conducts, ethical judgment, and accountability to practice. What is the consequence? Failure in professionalism is treated differently from failure in knowledge. Knowledge could be rectified, knowledge gap could be filled, but the professionalism should be taken seriously by the medical schools, dental schools, as well as the student. And recurrent relapse in professionalism raise the concern: are you be considered as a safe practitioner in the future or no? And this is questioning your fitness to practice. Why? Because this is directly threatening patient safety, public trust, and institutional credibility. So, professionalism is a social contract in health professional education. And as far as we are saying social contract, the medicine and dentistry operate under the societal contract, and this is a contract with the society. And the society grants us autonomy in clinical decision making for the patient. The society grants us also the self-regulation of our profession as a medicine or dentistry. And society also grants us the licensure and protected professional titles that we have. So, in turn, professional commits to placing patient safety, welfare above our self-interest, and to act ethically to address the societal needs. So, professionalism by default is the mechanism by which this contract is honored. And when professionalism erodes, society responds through increased regulations, loss of trust, and legal oversight. So for you as students, entry to medical and dental program represent early entry into societal contract, not merely enrollment in academic course, and we would like, please keep this in your mind. Let us define professionalism. What is the professionalism? What do you mean by professionalism? In medicine, require the physician to serve the interest of patient above self-interest. It is based on integrity, altruism, accountability, excellence, duty, honor, and respect to others. And it signifies a set of values, behavior, and relationship that underpin the trust the public has in the doctors. And it is very important to know how to demonstrate professionalism in your study and how to demonstrate professionalism also during your practice in the future. So professionalism is demonstrating through a foundation of clinical competence, and this is considered as a baseline. Communication skills and ethical and legal understanding upon which it built the aspiration to wise application of the principles of professionalism. And these principles including excellence, humanism, and altruism. And we will consider the last four, excellence, humanism, accountability, and altruism, as the pillars. These are four pillars, and the foundations, including the clinical competence, communication skills, ethical and legal understanding. And this is very clear, can be demonstrated in this figure. So the baseline, clinical competence, communication skills, and ethical and legal understanding as foundations, and excellence, humanism, accountability, altruism as pillars. Let us go and explore more these four pillars. Excellence, through which the physicians commit to continuous maintenance of knowledge and skills, lifelong learning, and advancement of knowledge. While humanism, in which we show compassion, empathy, integrity, and respect to our patient and society. Accountability, in which physician and other healthcare professionals take the responsibility for his or her behavior and action. We are accountable for each behavior and we are accountable for each action. And finally, the altruism is patient interests should come first. And we should act as providing the best of our effort to support the patient. And the patient interest should be over our self-interest. So it is a commitment to carry out professional responsibility, adhering to ethical principles, and sensitivity to diverse patient population. And this will let us to ask a very important question. Why professionalism failure is the matter? Professionalism failure is not a trivial issue. This will result, unfortunately, to loss of patient trust, increased risk of harm, breakdown of team functioning because we have a responsibility toward ourselves, toward the patient, and toward colleague, and toward advancing the knowledge in our profession. And also it has legal and regulatory consequences if we don't act professionally. And from educational perspective, professionalism labs signal potential risk to future patients. So as medical educators and other students, we should carefully look at this. And this is why the medical schools, dental and health sciences school treat such labs seriously and may impose remediation, delay progression, or sometimes dismissal if the two above fail. In order to understand professionalism, also we need to define the difficult terms that has been used for a long time interchangeably with professionalism, and we can consider this as core values underpinning professionalism. The first term is ethics, moral, principles, and values. Ethics defined in medical practice as professional codes and standards guiding doctors and dentists. And examples of ethics is considering confidentiality, taking informed consents before the procedure of surgery, or avoiding any conflict of interest. Moral is something personal belief that shape how a clinician responds to right and wrong. And example is refusing to lie on a medical record or showing compassion to a patient. Principles, it is universal standards that underpin medical professionalism, such as honesty in diagnosis, fairness in patient care, and integrity in research. Values, it is individual beliefs that influence daily practice, such as respect for patient, commitment for lifelong learning, and also teamwork. And another important value that we should also take into consideration is to show integrity. And integrity here is doing the right things in a reliable way, and it is doing the right things all the time, even when it may work to your advantage. And the most also important concepts related to integrity definition is doing the right things even when no one is watching. And it's very important also to highlight now with these values and these principles related to professionalism, we should also integrate the core principles and values in research because professionalism is something related to practice, to our learning as well as in research. And let us highlight the four values of medical research, or this is autonomy, beneficence, non-maleficence, and justice. Autonomy is related to respecting patient or research participants' right to make informed decisions about their care. Beneficence is act of the best interest to patient or research participants. Non-maleficence is we should do no harm while doing research or while providing service to the patient and avoiding causing unnecessary injury or suffering. If something that is unnecessarily, whatever it is procedures or research intervention, we should do no harm to our patient, to our participants, and to the community. While justice it is related to treat patient fairly and research participant fairly and ensure equitable distribution of resources. Example for the four values for the autonomy: obtaining valid informed consent before doing any procedures. Benefits such as providing effective pain relief or doing the best to your patient and research participant. Non-maleficence is avoiding unnecessary tests with harmful side effects, and justice is ensuring fair access to treatment regardless the background of the patient. Having said that and having providing these principles, we should now understand our responsibility as the physicians, and this responsibility actually will be from the physician charger. The first professional responsibility is professional competencies. We should always maintain knowledge and skills. And this will be through understanding the skills of learning. And in this course, we have started with professionalism because it is a basic and foundational for learning process. We have to, as a commitment to our patient, to the society, we have to keep ourselves updated. Honesty with patient, we have to provide truthful information. We should maintain patient confidentiality, and this is very important, and maintain appropriate relationship with our colleagues, with the patient, considering their rights. We should improve the quality of care, and not only the quality, the access to care. Ensuring using the resource wisely and fairly through just distribution of resource. We should uphold scientific standards and evidence practice by keeping our scientific knowledge updated. We should maintain trust, avoid any conflict of interest in research or in clinical practice. And also we should show professional responsibility and being accountable to patient, to colleague, as well as to the society. In order to do this, we should now understand early professionalism, and we should apply professionalism during studying of medicine and dental medicine. So this will raise this important question: why professionalism among medical and dental students and practicing physicians is important? Because patients expect physicians to be professional, medical society and accrediting organization expect physicians to be professional. Professionalism is associated with improved medical outcome, and now it is a business case there is a business case for professionalism. I'd like you to stop this video and to think about and to bring a paper and to think about examples of appropriate professional behavior of a medical student in medical college. Okay, so what are the elements of professionalism in relation today the daily life of medical students. They are these principles, including self, being professional toward yourself, toward your peer, medical teacher, university and college administration, to the learning resource, academic environment, community, and the profession itself. And this will be through different sets and different measures. I'm going to talk to them in the rest of the presentation, starting from doing the assignment and writing and avoiding plagiarism. Plagiarism is some sort of academic misconduct. And let us start with plagiarism and professionalism in writing. And let us explore the different part and different type of plagiarism. The first one is direct plagiarism, in which copying text word for word without crediting, without mentioning the source of information. Or mosaic or patchwork plagiarism, in which mixing copy phrases with your own, writing without proper citation. Or paraphrasing plagiarism, in which rewriting someone else's idea in different words but without acknowledgement. And self-plagiarism, in which reusing your own previous work, assignment, articles without citations. Accidental plagiarism, in which unintentionally failing to cite source correctly due to carelessness or lack of knowledge. And finally, complete plagiarism is submitting someone else's work entirely as your own. So this is an example of academic misconduct in academic writing. What else? There are other examples that are considered as academic misconduct, such as hiring someone to write your paper and submit it as your own, working in partnership with other students and presenting a paper as your own, submitting assignment so that each student, or splitting a group assignment so that each student write one part only for a group assignment. So we expect that all students to do the same, to do the equal effort. Cheating in exams also considered as plagiarism, and fabricating data also considered as plagiarism. And we should not forget now the AI. And AI actually is becoming integral part of our life. And we should use AI to advance knowledge and to be more productive. But when using AI, we are always referring to national and ethical use of the AI. Also, I'd like to shed the light on the ethical use of the AI in this presentation, which is very close to professionalism. So what do we mean by ethical use of AI in medical education and medical practice? We should not use AI to cheat on exams or assignment. We should be transparent, disclosing AI use in academic and clinical work when required, and we should also mention which tool did I use in the AI. We should cross-check AI output and trust with the trusted medical sources, because some tools they are doing hallucination with the AI. We should never enter patient data into AI, because this is confidential information, and we should remain responsible for our work when using the AI. We can use AI to support maybe ideas, grammar, structure, but we should ensure proper citation. This is a very important aspect related to the AI. It's very important also to maintain professionalism while writing email as a student. So if we can see these examples of email, please stop the screen now for the video and try to let us know which one is the most appropriate, sample 1, sample 2, or sample 3. What is the problem with each one? So sample 3 is the best. Why? Because it shows the following. There's a clear subject heading, start with creating In the first paragraph in the email, we should include the informations on why you are writing this email. It should be clear, direct. And, then in the middle paragraph, it should describe if you are asking for help or whatever. And the final paragraph, you should conclude the email by thanking your professor. And you should add your email signature, which including your email, year of study, and so on. This is very important thing that should be considered. Part of plagiarism, part of professionalism is to adhere to the self-regulation of your university and college. This is very important as medical students and dental students, is to ensure that you are adhere to the student's handbook. And this example of handbook of one of the medical schools that you should revise this handbook, code of conduct, including what should you do and what should avoid, and so on. So what are we also need to know what are the examples of non-professional behavior that we should avoid as students. One of them is failure to engage with the assignment, deadlines, poor teamwork, and so on. Or example of also non-professional behavior is dishonest behavior, such as cheating in exams, plagiarism, data fabrication, data falsification, and so on. Or disrespectful behavior, such as poor verbal, non-verbal communication, inappropriate use of social media, posting photos with patients, and so on, inappropriate clothing, disruptive behavior during teaching, attending late to the class, and so on, with your colleague, bullying, discrimination, and so on. Or some of them related to poor self-awareness, such as avoiding feedback, lack of insight behavior, blaming external factors, not accepting feedback, resistance, and so on. So it's very important to be aware of this non-professional behavior. Now I'm coming to the end of this video with the take-home message. So professionalism is the foundation for studying medicine and dentistry and for the practice. It is important. Why? Because it builds trust with patients, with peers, with the society. And every action in your study, in your research, in your online presence, in the social media, in your clinical practice reflect your profession. And knowledge and skills make you competent, but professionalism make you trusted, and patients want to be seen by trusted doctors. We should live with integrity. We should respect with respect. We should live with accountability and compassion to every day of life. Thank you so much for watching this video. And the next video will be about the principles of learning. We intentionally start with professionalism as the sense, as the foundation, and then we'll move to the next video, which will be about the principles of learning. Thank you so much for watching, attending this video. See you, inshallah, in the next video.